Hello, my name is Amanda Schrader, and this is a presentation on type 1 diabetes in children. I am a nursing student at Indiana State University. Learning objectives. By the end of this presentation, you should understand how type 1 diabetes affects the body, recognize signs and symptoms of hypoglycemia, recognize signs and symptoms of hyperglycemia. The viewer will have a basic knowledge in the treatment of diabetes, have a basic of an understanding of what an average day is like for a child with diabetes, understand common misconceptions regarding diabetes, know complications that can occur later in life, know what a CGM is and the basics of how it works, understand routine management for type 1 diabetes, and recognize an insulin pump and introduction into how it operates. At this time, if you'd like to click out of the presentation, you can take the pretest posted in the link below. What is type 1 diabetes? Type 1 diabetes is a complex balance of food, insulin, exercise, and body stresses. It's also known as insulin-dependent or juvenile diabetes. This is usually diagnosed in childhood or teen years. It's an autoimmune condition that leads to the destruction of beta cells in the pancreas. Therefore, the pancreas doesn't make or makes very little insulin. Insulin is necessary to help glucose enter the cells. Without insulin, glucose cannot enter the cells and the glucose becomes built up inside the body. In the picture on the left, you can see the yellow organ. There's the pancreas, which is excreting a very small amount or no insulin. The blue dots there are the glucose, showing that they cannot get into the cells, so the muscles and organs are unable to use the glucose due to the low insulin. On the right, you can see a picture showing how insulin is the key to get glucose into the cell. Without insulin, glucose cannot get in there. Facts about diabetes. 1.25 million people are living with type 1 diabetes in the United States. There's no known cure and no known way to prevent diabetes. Type 1 is less common than type 2. Only 5 to 10% of diabetics are type 1 diabetics. The peak presentation for diagnosis of type 1 diabetes is between the ages of 5 and 6, and then again there's a rise at the age of puberty. This is more common in males and more likely to be diagnosed in the fall to winter months. Symptoms of type 1 diabetes include polydipsia, which is excessive thirst, polyuria, which is excessive urination, weight loss, irritability, fatigue or lethargy. Another symptom of type 1 diabetes, if the sugar is really uncontrolled, can set into diabetic ketoacidosis. Symptoms of that include abdominal pain, altered mental status, a fruity smell to the breath, vomiting, Kussmaul breathing, which is deep, rapid, and labored breathing. If not treated, DKA can lead to coma or even death. All about insulin here. Basal insulin is your long-acting insulin. It's only injected 1 to 2 times a day. Its peak effects are at 1.5 to 2 hours, and the effects of this long-acting insulin last 12 to 24 hours. Example brand names of basal insulin are Lantus or Levemir. Short-acting insulins have a much quicker onset. You use the short-acting insulin 3 to 4 times a day whenever you eat meals. The onset of action for this insulin is 5 to 60 minutes. Peak effects are 1 to 4 hours, and the insulin lasts 4 to 8 hours in the system. Brand names of this include Humalog and Novolog. Also, I wanted you to note down on the bottom left corner of that picture are pictures of insulin pens that can deliver the insulin, measured insulin out there, or on the bottom right is a picture of a syringe where the child or parent would draw up their dosage of insulin through a syringe and then inject it. Hypoglycemia. Hypoglycemia is low blood sugar, which is less than 70. It's caused by too much insulin or too much exercise, waiting too long to eat, and can happen very quickly. Symptoms include shakiness, lightheadedness, irritability, weakness, hunger, sweating, and headaches. Hyperglycemia is an excess of glucose in the system. Usually that number is different for each person, but high number would be 150 upwards to 400 or so. This is caused by too little insulin in the system. Also, diabetics, when they are ill, their sugars can become hard to control and tend to run on the higher side and become hyperglycemic. When symptoms present for hyperglycemia, usually includes increased urination, abdominal pain, dry skin or mouth, and increased thirst. Blood glucose meters. Here on the left, you can see what a blood glucose meter looks like. There's the actual monitor there. There's a lancet to prick the finger, and then you can see at the top there the strip is where you insert that into the monitor and then apply the drop of blood to the lancet. It usually only takes a few seconds for the monitor to read what blood glucose is. The normal range for a blood glucose level is typically between 70 and 150. Here, this is a continuous glucose monitor, also known as a CGM. On the right there, you can see the child's arm. That's the sensor that subcutaneously attaches into the skin and detects changes in glucose. It's a continuous monitor, so it monitors 24 hours a day. The three components of a CGM are the sensor that's in the child's arm, the transmitter, usually like a cell phone, which relays the information from the sensor to the actual receiver, such as this Dexcom device pictured, and then the receiver displays the information. This records every 5 to 15 minutes. There is a slight lag time in the blood sugar level due to the device measuring the interstitial glucose instead of the actual blood glucose. So it will be slightly different than a finger prick, but this is still a very useful tool for children, especially to have. They may not be able to recognize when they're feeling like their blood sugar is too low or too high. So this is a way parents can continually monitor them even when they're away from them. They can look at their app on their phone and see what their Dexcom app is showing as far as where their blood sugar range is and if they need treatment for that. Insulin pump. Insulin pumps deliver rapid acting insulin only, so you would still have to self-inject the long-acting insulin that you would do 1 to 2 times a day. The insulin pump works with a small cannula that is inserted just underneath the skin. Usually there's a basal rate where it's giving a continuous steady flow of insulin, which helps level out those peaks of blood sugar levels throughout the day. The insulin pump, you would calculate a bolus at mealtime. Once you know how many carbs you are eating and what your current blood glucose is, you would enter that into the device, and then it would go ahead and pump the specified amount of insulin needed into the patient just under the skin there. Management of type 1 diabetes includes routine blood work, which would include orders such as a hemoglobin A1C that measures the average glucose over the past 3 months. Normal glucose or hemoglobin A1C level for type 1 diabetics would be ideally below 7.5. Type 1 diabetics usually meet with their endocrinologist quarterly. They also, when they are first diagnosed, meet with a dietitian and a diabetes educator. They do finger sticks. CGM if their insurance approves that they can have that continual glucose monitor. Some will also approve insulin pumps. The most important part of management is to know that diabetes is unpredictable. Complications that can occur later in life if diabetes is poorly managed in childhood. Type 1 diabetics are more prone to cataracts, retinopathy, renal failure, hypertension, heart disease, neuropathy, and increased susceptibility to infections. Type 1 diabetics' life expectancy is also decreased 10 to 20 years on average. An average day in the life of a child with type 1 diabetes, just a quick idea of what a day is like for them. They would wake up and check their blood sugar prior to breakfast. They would have to count their carbs, or their caregiver count their carbs, and then dose them with insulin to either correct their blood glucose level if needed, and also cover their carb count for breakfast. Their sugar would have to be monitored throughout the morning while at school. If they participate in PE class or exercise in the morning, sometimes they need a snack. If they're running too high, they may need a finger stick and a corrective dose of insulin, which would be another needle poke for them. Then at lunch, they would check their blood sugar again before lunch and receive another dose of insulin. Again, you would be counting the carbs and checking their glucose range to see if it needs correction. Monitored through the afternoon for highs and lows that need corrected off and on. They would check their blood sugar again before dinner and inject another bolus of insulin. And then before bed, they would also take their long-acting insulin. And that's just a typical day without illness or any unexpected things that might pop up. So you can see how this is a chronic condition that requires a lot of attention and a lot of change to their normal routine as a child. Common misconceptions about children with type 1 diabetes include that they cannot eat sugar. That's not true. They can eat sugar. They can eat as much sugar as they want, really. They just have to be covered with insulin for the amount of carbs that they're consuming. Their diet and lifestyle choices caused type 1 diabetes. That is not true. It's an autoimmune disorder and not related to any diet or lifestyle. Kids with diabetes cannot participate in sports. Again, that's not true. If they are participating in sports, they may need a snack beforehand to keep their blood sugar levels from dropping, but they can still participate normally. Eating too much sugar causes diabetes. Again, that is not true. That is not a cause of type 1 diabetes. In conclusion, diabetes is an autoimmune condition that leads to the destruction of beta cells in the pancreas. There's still no cure. Hypoglycemia is when the glucose levels are too low. Hyperglycemia is when the glucose levels are too high. BGM, CGM, and insulin pumps are all options used in management of type 1 diabetes. You use long-acting and rapid-acting insulin in type 1 diabetes, and this can lead to serious complications later in life. At this time, if you would like to click out of the presentation, there's a post-test you can check to see what you learned, and also a brochure with additional resources available. Thank you for watching.